If you wake up every morning feeling like your lower back is made of rusted iron, you probably think it's just old age or permanent arthritis. You drag yourself to the edge of the mattress, brace your hands on your thighs, and mentally prepare for the first 20 minutes of the day, just trying to stand up straight. I see this every single week in my clinic. People come to me convinced that their spine is completely worn out, or that they need to spend $3,000 on a medical-grade mattress just to get some relief. But what if I told you the real cause of your morning misery isn't irreversible aging, and it isn't your mattress? What if the hidden culprit damaging your discs and tightening your muscles is actually happening at 2 a.m. right while you sleep? Hello, I'm Dr. Marcus, a doctor of physical therapy specializing in geriatric orthopedics and joint biomechanics. Over the years, I've helped thousands of seniors understand what's really happening inside their joints so they can stop treating the symptoms and start fixing the root cause. By the end of this video, you are going to understand exactly why your back feels so locked up when the alarm goes off. More importantly, I'm going to show you a simple, entirely free, and biomechanically safe pillow protocol you can use tonight to decompress your spine, allow your discs to heal, and finally wake up pain-free. But before we get into the exact mechanics of what's happening to your spine in the dark, I want to know about your current habits. Tell me in the comments below right now, which sleep position do you usually wake up in? On your back, your side, or your stomach? Drop your answer down below, because we are going to talk about all three today. Let's talk about a patient of mine. Let's call him Arthur. Arthur is a 68-year-old retired high school teacher living in Madison, Wisconsin. When he first came to my clinic, he was frustrated and, frankly, a little scared. He told me, "Dr. Marcus, I used to love playing golf early in the morning, but now, the first 30 minutes of my day are pure agony. My lower back throbs, my hips feel extremely stiff, and sometimes I even get a little sharp twinge shooting down into my glute." Arthur had tried everything he could think of. He bought expensive memory foam mattress toppers. He took over-the-counter pain relievers right before bed. He even started doing aggressive toe-touch stretches the second his feet hit the floor, which, by the way, I strongly advise against doing first thing in the morning when your spinal discs are at their most vulnerable. But nothing worked. Arthur was starting to accept the false assumption that losing his independence and giving up his morning tea times was just the unavoidable price of getting older. He assumed his joints were grinding together all night. But when I looked at his MRI and evaluated his mobility in the clinic, I saw something entirely different. Arthur didn't have severe bone-on-bone friction that required massive surgery. He had mild age-related disc wear, perfectly normal for a 68-year-old. The real issue was a mechanical flaw in how he was resting. His nighttime posture was putting his lumbar spine under continuous, unrelenting tension for 8 straight hours. What I want you to understand about your joints is that sleep is supposed to be the ultimate recovery tool. During the day, gravity is your spine's biggest enemy. Every time you walk, sit, or lift a bag of groceries, the soft, shock-absorbing discs between your spinal bones are compressed. It's like squeezing a wet sponge. The fluid gets slowly pushed out. Nighttime is when those discs are supposed to decompress. When you lie down and take gravity out of the equation, your discs act like a dry sponge placed in a bowl of water. Through a biological process called imbibition, they naturally soak up water, oxygen, and vital nutrients. They plump back up so they have the structural integrity to protect your spine the next day. But here's the hidden catch that ruined Arthur's mornings, and might be ruining yours. Disc imbibition only works if the spine is in a neutral, relaxed position. If you sleep in a way that twists your pelvis or arches your lower back, you are effectively wringing that sponge out all night long. You aren't resting. Biomechanically, you are holding a bad, stressful stretch for 8 hours straight. Imagine pulling your index finger back as far as it can go and holding it there for a third of the day. When you finally let go, that joint is going to be incredibly stiff, sore, and inflamed. That is exactly what you might be doing to your lower back, your sciatic nerve, and your intervertebral discs every single night. The morning stiffness you feel isn't just old age catching up to you. It's the mechanical consequence of an overnight stress test on your spine. To truly fix this, we need to dive into the biology of the night. As I mentioned, your spinal discs operate just like sponges. During the day, gravity and movement squeeze the water out of them. At night, through that process called imbibition, they are supposed to soak water, oxygen, and nutrients back in. But here is the critical biomechanical truth. Fluid cannot enter a disc that is actively under pressure. If you are sleeping in a twisted or strained position, the sponge remains squeezed shut. Over time, those discs become dry, brittle, and flat. This is exactly what accelerates cartilage wear, causes herniated discs to bulge further, and leaves you with that agonizing morning stiffness. Let's break down the 3 most common nighttime postural mistakes I see in my clinic, why what you've been told about them is probably wrong, and exactly how to fix them. Mistake number 1, the pelvic twist. Most seniors I treat think that sleeping on their side, curled up in the fetal position, is the absolute safest way to protect a bad back. They think it takes the pressure off. But for the vast majority of side sleepers, this is completely wrong. Why? Because unless you are perfectly supported, your top knee naturally drops down to rest on the mattress. When that top leg drops forward, your pelvis rolls with it, but your shoulders usually stay put. The real mechanism happening here is severe rotational stress. You are creating a massive twisting motion, what we call pelvic torsion, directly at the L4 and L5 vertebrae. Let me tell you about Robert. Robert is a 64-year-old retired mechanic from Dallas, Texas, and a dedicated side sleeper. He came to me with a confirmed L5-S1 herniated disc. Every morning his sciatic pain was firing on all cylinders. He thought his walking routine was aggravating it, but the reality was his top leg was dropping forward every night, aggressively twisting his lower spine and actively squeezing that herniated disc against his sciatic nerve for hours. The treatment here isn't a new mattress or expensive pain pills. The remedy is blocking the twist. You must place a firm, thick pillow between your knees and thighs. It has to be thick enough to keep your top hip perfectly stacked over your bottom hip, parallel to the ceiling. When Robert started using a proper knee pillow, the rotational stress stopped. His disc could finally decompress, and his morning sciatica practically vanished in 2 weeks. Mistake number 2, lumbar hyperextension. Stomach sleeping is notoriously bad for you, but people who sleep on their stomach often think it's just a harmless personal preference, or perhaps a way to stop snoring. What they don't realize is the severe mechanical trauma it causes. When you lie on your stomach, 2 things happen. First, you have to crank your neck almost 90 degrees to one side just to breathe, which wreaks havoc on your cervical spine. But down in your lower back, your abdomen sinks into the mattress. This drags your lumbar spine into deep hyperextension, an extreme, unnatural arch. You are forcibly jamming the facet joints at the back of your spine together and heavily compressing the posterior side of your discs. This brings me to Helen, a 71-year-old grandmother from Seattle. Helen was a lifelong stomach sleeper. She started waking up with sharp, pinching pains in her lower back and deep aches in her neck. She was convinced her bed was to blame and was literally days away from spending $2,000 on a brand new luxury mattress. I told Helen to save her money. Her mattress wasn't the problem. Her hyperextension was. If you are a strict stomach sleeper, the ultimate goal is to transition to your side or back using strategically placed body pillows to block you from rolling over. But if you absolutely must sleep on your stomach, the immediate remedy is to place a flat pillow horizontally under your lower abdomen and pelvis. This lifts the hips and flattens out that painful lumbar arch, taking the crushing pressure off your facet joints. Mistake number 3, the flat bridge. Many people think that sleeping flat on your back without any support under your legs is the picture-perfect posture for a healthy spine. It looks straight, so it must be good, right? Wrong. When you lie flat on your back with your legs fully extended, it pulls tightly on your psoas muscle, a thick hip flexor that attaches directly to your lower lumbar vertebrae. Because this muscle gets very tight from sitting in chairs all day, lying flat with straight legs pulls on the psoas, which in turn pulls your lower spine forward, lifting it right off the mattress. You end up creating a bridge of tension in your lower back. Your muscles have to stay contracted all night just to support that arch. The remedy is incredibly simple. By placing a bolster or a large rolled-up towel under your knees, you put a slight bend in your legs. This instantly puts the psoas muscle on slack, allowing your lower back to drop down flush and completely relax against the mattress. Now, I want to pause here and give you a very clear medical caution. I want you to be safe. The positional fixes we are talking about are for mechanical joint pain and standard disc issues. If your morning stiffness lasts for hours rather than 20 or 30 minutes, or if it is accompanied by swollen hot joints, you may be dealing with an inflammatory condition like rheumatoid arthritis, which requires specific medical management. Furthermore, if your back pain ever comes with sudden numbness in your groin, a loss of bowel or bladder control, or a foot drop where you can't lift your toes, do not look for internet remedies. Those are medical emergencies, and you need to go to the emergency room immediately. But for the vast majority of you dealing with standard wear and tear, arthritis, or a bulging disc, taking control of your nighttime biomechanics is the fastest way to get your life back. In fact, the next time you see your physician or physical therapist, I want you to ask them this exact question. Is my nighttime posture creating pelvic torsion that's irritating my herniated disc or lower back? Asking that specific question shifts the conversation from just managing pain to actually solving the mechanical problem. Speaking of mechanical support, I want to check in with you again. Does your mattress at home feel too soft, letting you sink in like a hammock, or too firm, pushing your hips and shoulders up? Tell me below in the comments. Your mattress firmness heavily dictates how thick your supportive pillows need to be. Coming up, I'm going to give you my complete, step-by-step pillow protocol checklist so you can set your bed up perfectly tonight. I'm also going to show you the one crucial technique you must use when getting out of bed tomorrow morning, so you don't instantly undo all the healing your spine just achieved. Welcome back. Now that you understand the hidden biological mechanics of how your spinal discs desperately need to decompress and rehydrate overnight, it is time to put that knowledge into action. This is the exact step-by-step pillow protocol I teach my senior patients in the clinic to halt nighttime joint damage and restore their morning mobility. If you are a side sleeper, you need two things to keep your spine in a neutral, healing position. First, as we discussed, you need a firm, thick pillow placed between your knees and your thighs. Do not use a thin, worn-out feather pillow that just flattens to the thickness of a pancake. It needs enough density to keep your top hip perfectly level with your bottom hip. But here is the secret second step. If you have a naturally softer mattress, your heavy hips will sink in, creating a lateral bend, a side curve in your lower back. To fix this, take a small hand towel, roll it up, and place it right into the curve of your waist, just above your pelvis. This acts as a bridge, filling the gap and keeping your spine perfectly straight from your neck all the way down to your tailbone. If you are a back sleeper, your setup is even simpler, but just as crucial. You must take the tension off your psoas muscle so your lower back can rest flat against the mattress. Take a large, firm bolster, or roll up a heavy bath towel and place it directly under your knees. You want your knees slightly bent at about a 15 to 20 degree angle. The moment you slide that bolster under your legs, you will literally feel your lower back melt downward into the bed. The tension simply vanishes. But setting up your bed perfectly is only half the battle. The most dangerous moment for your spine is actually the first 10 seconds after you wake up. Remember the sponge analogy? Your discs have spent the last 8 hours soaking up fluid. They are fully hydrated, plump, and at their absolute tightest. If you sit straight up like a vampire in a movie, or if you twist your torso to reach for your alarm clock, you are putting massive, crushing force on a fully pressurized disc. That is a prime recipe for triggering an acute herniation or a severe muscle spasm. Instead, you must use the clinical standard for getting out of bed, the log roll. Here is exactly how you do it. Before you even think about sitting up, bend both of your knees while lying on your back. Next, roll your entire body over onto your side all at once. Your shoulders, hips, and knees must move together as one solid unit, just like a rolling log. Do not twist your upper body first. Once you are on your side near the edge of the bed, Let your legs gently drop off the side while simultaneously using your bottom elbow and top hand to push your torso straight up. Your spine stays completely rigid and your arm and leg weight do all the mechanical work. I want to bring this back to Arthur, the 68-year-old retired teacher from Wisconsin who was terrified he would never play golf again because his mornings were so agonizing. Arthur went home and started applying this exact protocol. He bought a firm $20 memory foam pillow for between his knees, and he committed to the log roll every single morning. He didn't buy a new mattress, he didn't take any magic supplements, he just respected his body's biomechanics. When Arthur came back to my clinic 2 weeks later, the change was incredible. That 30 minutes of agonizing, throbbing morning stiffness had dropped down to just 5 minutes of mild, normal morning tightness that vanished as soon as he walked to the kitchen. His discs were finally getting the overnight rest and rehydration they desperately needed. He wasn't wringing out his spinal sponges anymore. Today, Arthur is back on the golf course, taking the early tee times he loves, completely free from the fear of losing his independence. You do not have to accept morning misery as a permanent sentence of getting older. You have the power to change how your body heals tonight. Now it's time to take action, and I want to know exactly what your next step is. Comment, "Trying tonight." If you are going to set up your pillows and use this spinal alignment protocol right now. Comment, "Asking my doctor." If you are going to bring up pelvic torsion and nighttime disc compression at your next medical visit. Comment, "Sending this." If you know a friend, a spouse, or a loved one who tosses and turns and desperately needs to hear this advice. Your joints are designed to heal, but you have to give them the right environment to do it. If you found this clinical breakdown helpful, please hit the like button, share this video with someone who needs it, and make sure you subscribe and save this video so you can review the log roll technique whenever you need a refresher. I'm Dr. Marcus, and I'll see you in the next video.